Recently, we received an email to Veteran Caregiver, which spoke of the underlying sadness of a caregiver even as she was stabilizing in her role, caring for a wounded soldier with traumatic brain injury and limb loss. She'd been to the doctors and learned that her condition was likely mild depression associated with ambiguous loss. This may be a term you've not heard often, but is probably one you understand all too well. Stated simply, it refers to a loss or grief that is unclear and without closure. If you read the book or saw the movie Unbroken, you may recall the devastating story of Louis Zamperini, who was held for 2.5 years as a Japanese POW, leaving his family at home with deep cycles of emotional pain and uncertainty. This is an example of ambiguous loss. Is his situation that different from many returning vets today who also return from war and fall into a cycle of managing their PTSD or TBI by self-medicating, distancing themselves from family and friends, and sometimes fighting the need to receive treatment? A returning service member who comes back from war different or changed is physically present, but they are not the same. The realization and acceptance you experience is ambiguous loss. Whether you recognize or acknowledge it as ambiguous loss, doesn't the family go through a period of grief, adjusting emotionally to accepting that life is now different? What about a returning vet with TBI? Isn't it true that many adjustments are made to find new footing and stability with the results of the brain injury? Consider those caregivers for older veterans, some of whom may have been developing Alzheimer's or dementia. This is a period of uncertainty and sadness for losing what once was the anticipated future. It's normal to first realize the symptoms of medical conditions, but it's valuable to also realize there may be several other reasons for caregivers to seek counseling and peer support. Please be kind enough to yourself to realize that mourning the loss of the future you'd once accepted is normal. In a way, knowing there is a term to apply to how you are feeling may be a relief. Ongoing grief casts a shadow over your life, and therapy directed to affirming your experience may bring you understanding and light. Ambiguous loss is real. There is great hope and healing in receiving treatment and counseling, and we hope this opens the discussion for veteran families from every era.